Welcome to Section 2 of Chapter 2, Per Member Per Month Overview.
The next methodology we're going to talk about is PMPM, per member per month. It's also called capitation. Capitation, or per member per month, is really an old methodology that's now come back into the market. Oftentimes, or sometimes, it can be mixed with a fee-for-service model. So you might be getting a base rate fee-for-service model plus a PMPM payment on top of that for attributed lives. So attributed lives are those members, those patients that are assigned to your practice. As you know, patients come and go. So understanding who is attributed to your practice is really important, and kind of keeping an eye on that. They're going to send, the health plans will send you a list of these are the patients, these are our members that are assigned to your practice. You want to pay attention to that list to be sure that it's accurate. If you have more than what they're showing, then you might be due some additional reimbursement. You might actually have less as people move around a little bit. The PMPM methodology has, depending upon how you're paid, may have a lot of risk involved. You're responsible for that one per member per month payment for the health care of those patients. Again, depending upon how the model is structured. If it's pure PMPM or pure capitation, that number needs to be quite high depending upon the patient. Most of these methodologies are age-sex adjusted, so somebody that is older and maybe sicker would have a higher PMPM payment than a younger person that, doesn't need to come in and see you. One of the things you want to factor into this is that integration of behavioral health. Keep in mind, at the end of the day, this is all about keeping people out of the hospital, out of the emergency room, and maybe even out of specialty offices where they're not needed to go see them for chronic conditions. You're going to be managing those patients and blending that behavioral health and medical services together, helping the health plan to save money. You should be paid for that. You have to tell the story with your information. So what kinds of patients do you have? Go through your even claims data, go through that data, find out the kinds of patients you have and how you're saving the health plan money by you taking care of these patients on that PMPM or capitated basis. The PMPM model attributes lives to your practice. You're getting paid to manage these patients. You may actually go out and get those patients. So if you have a patient that you know has maybe some chronic issues, maybe some behavioral health issues, and the patient is not coming to see you, you might actually reach out to get them, because again, the game is all about lowering overall costs. That's what's going to make you more valuable, certainly more valuable to your patients. We all know that, and it's great stuff. It's also going to help you to be more valuable to the health plans, but you have to show it to them. You have to show them that you're seeing all these patients. Even in a pure PMPM model, you may not have a claim for every single service. It depends on how the model is structured, but you're going to kind of want to brag it up a little bit and show them how you're taking care of these patients.
There are various tools that exist to help you show your data to the health plans. You have access to some data aggregation tools, cost and utilization reports, and even your EHR system is a great place to pull information. Use these tools, gather your information, to show the health plans how well you are managing your patients.
The health plans themselves in a PMPM model are also, they have data on you as well. And you want to work with the health plans, look at their information, point out using their own information how your overall ER costs, just as an example, are lower than the market average. That is what makes you valuable. That's how you start to have a conversation about rates and how to have a better contract and relationship with that health plan. A PMPM, per member per month, methodology of payment is not something you should be afraid of. We've seen a lot of these models that, again, that are mixed together with a fee-for-service base model. It works really well in a practice that is really managing the breadth of a patient's experience with the healthcare system. you're going to be paid for not only managing these patients, but delivering specific levels of care. It is a model that works great in mixing both medical services with behavioral health services, because what you're really doing is you're identifying and managing chronic conditions. You're keeping patients out of the emergency room, out of inpatient care in your practice, and you should be paid for it.